So today let us look at some of the mnemonic that are used in medical field. So we are going to start with lidocaine toxicity. Lidocaine toxicity. Lidocaine toxicity, if you've been asked about it, you just write sums. So these are just signs that a patient will present with when a patient has lidocaine toxicity. So SAMS, S will stand for slurred speech. A will stand from altered central nervous system. M will stand for muscle twitching. And S will stand for seizure. Those are some of the lidocaine toxicities that a patient will present with. Let's go to number 2. We are going to learn 5 of them. Number 2, if you've been asked symptoms treated by thiazides, the most commonly used oral diuretics. What are symptoms treated by thiazides and the most commonly used oral diuretics? So that one you just write, okay, symptoms treated by thiazide. Then the most commonly used oral diuretics. Just write chick. So most commonly used oral diuretics, just write chick. I mean those symptoms treated by thiazide and the most commonly used oral diuretics, just write chick. First one is congestive heart failure. Second is hypertension. HTN, this medical student knows all these signs. And the next I is insipidus. And the last one is calcium. Calcium calculi. Those are some of the symptoms. So those are some of the signs treated by the thiazide drugs, the most commonly used oral diuretics. Yeah, so symptoms are congestive heart failure, HTN, insipidus, and then calcium calculi. So let's look at side effects of morphine. Side effects of morphine. Morphine. Main drug. So you just write morphine. You just write morphine. So morphine, M for meiosis, O for out of it, or sedated. R for respiratory distress. Respiratory distress. We have pneumonia. Hypotension. Infrequency. We have nausea. Emesis. Yeah, side effects of morphine. You just write morphine and then you fill in those things. The next mnemonic is treatment of ventricular arrhythmias. Treatment of ventricular arrhythmias. You just write pulse. P stands for proinadamide. Proinadamide. Yes, proinadamide. The next one is amiodarone, and the next one is lidocaine, and the next one is sotalol. These are treatment of ventricular arrhythmias. Yeah, treatment of ventricular arrhythmias. These are just drugs that you use to treat those the ventricular arrhythmias. Okay. Number 5 and the last one. Every day in nursing lecture room, we are going to learn at least 5 mnemonic that will help medical students. So number 5, we have steroids. About what are steroids? You have to know what are steroids, and then if you're going to ask about steroid, just write 6S. So 6S, 1, 2, 3, 4, 5, 6. S ya kwanza, you can write, okay, this 6S means sugar, soggy bones, 6 sad salt sex. Okay, sugar, soggy bones, 6 sad salt sex. So this one, sugar, which means you treat hyperglycemia. Soggy bones, causes of osteoporosis. You treat causes of osteoporosis. Sick means decrease immunity. And then sad means depression. And then salt means water and salt retention, which the patient means has HTN. So you treat that. And then the last S is decrease libido. Decrease libido. So you treat also that with all those. That is the mnemonic that you can use to answer that question, or the formula you can use to if you are talking about steroids.